All right, guys. So first of all, I'd like to thank everybody for coming. Right. My name is Dr. Vincent Adamo. Most of you guys already know that. Tonight we're doing a workshop called Health and Stress Workshop. How stress affects your health. So we're going to be going over some research tonight on what causes stress, how some of us hold on to stress, and then certain ways to relieve stress. Because a lot of us have stress, right? Who in here has some stress? Right? Did we ever print out those stress surveys? Okay, so as I'm talking tonight, Christina and Allie are going to pass around a stress survey, and we're actually going to see what you check off and see how much stress you really have. There's a lot of questions on there. As you're listening to me, you're going to actually check off which areas of stress that you have. Okay, let's get clipboards out, and we'll get you guys to do that. So we're going to be paying attention to both TVs because this is a PowerPoint presentation, so we'll be reading off a PowerPoint, and I'll be discussing what's going on with this PowerPoint. So it gives you the definition of stress. The definition of stress. Stress is a heightened response to routine and out of the ordinary conditions of events. Okay, so it says the statistics on stress. 78% of all visits to the doctor are stress-related illnesses. How many people agree with that? All right. It says people who experience heightened levels of anxiety are 4 to 5 times more likely to have fatal heart attacks or stroke. So how many people here now have anxiety too? A lot of people saying I have anxiety. Yeah, exactly. 50% of all illnesses are caused by stress. Now I always like to go into different types of stress. Everybody knows that we have physical stress, right? So that means like we're physically working every day, right? We physically get up in the morning every day. We physically do things with our body. People don't realize that we also have chemical stresses. There's tons and tons of pollution out in the air that we breathe in. That's a chemical stress on our body. Some of us are taking medications. Well, hopefully none of us are taking medications, but some of us are taking medications. That's chemical stress on the body. Some of the different foods and toxins that we put in our body are chemicals that cause stress to our body. So there's physical, chemical stress, and then a lot of people don't understand that there's emotional stress. Some of us are married, husbands and wives cause each other stress. People have kids that cause us stress, emotions. Sometimes finances could cause you stress, right? Money problems. So there's all different types of emotional stress that you can get too. So there's different stresses that we're under on a daily basis automatically. Just the minute we get up and take a breath, we're under stress. So how many people can agree with that, right? So the key thing to learn tonight is how can we get healthier from stress, right? So let's just keep going with some stats here, some research. It says during the past 10 years, stress-related or on-the-job injuries have increased by 5 to 15%. 70% of people who surveyed are stressed at work, right? Does that make sense? I know a lot of you sitting here are coming from work and saying, oh man, I had a really stressful day. I need this adjustment. It says 43% that they surveyed suffered from noticeable physical symptoms, meaning that your stress, either physical, chemical, emotional, is affecting you physically, right? People are getting headaches, they're getting back pain, they're getting neck pain, they're getting soreness, right? So a lot of types of stress actually affects your body physically. So that's why a lot of people come to the chiropractor, to get worked on physically, instead of taking what? Medicine, right? Because medicine does what? Is medicine going to fix the stress? No, right? So then the more medicine you're taking, what does that mean? The more stress, because it stresses other part of your bodies, and then you never come off the medicine either. Because once the doctors put you on the medicine, how often are they saying to come off of it? Not very often. Okay? It says some areas of life that can cause stress. We already talked about a lot of this. One's job, money, junk food, medical drugs, relationships, your children. We talked about that. So I left this slide up here when I was researching. It says, to avoid stress, you need to avoid life. Isn't that crazy? Right? So, it's like, it's trying to say like, basically like, we don't want to say this on camera, but it's like, to avoid stress, we need to kill ourselves. And that's not what we're saying here, okay? But it's saying everybody's under some sort of stress every single day. And some people are retired right now, but you're still under stress, right? Because you have grandkids, right? And you're driving your wife to work, or you're going to the mall, and you're doing certain things, and you're breathing in the pollution. So everybody's always under some sort of stress. It's how we deal with stress. And it's how we're able to keep our bodies healthy during stress that makes the differences. So that's what we want to learn tonight. It says one of the world's early researchers studied stress, Dr. Hans. He documented that the stages a person goes through the situations in life. The first stage is called the alarm stage. The body goes into something called a fight-flight response, and that's a mechanism to a situation in life. For an example, like when the police car goes, like the lights, the sirens go on. So you know if you're driving your car and the sirens go on behind you, what happens? Your heart starts doing what? Whoa, whoa, what's going on here? Uh-oh, I'm in trouble. Or what did I do? Or for me, it's usually I did something wrong, but hope that you
got caught.
Yeah, I got caught. But so there's different types of stress responses that our body will be under as well. So the first one is called the alarm stage. The second one is called the resistance stage. It says your body either adapts to the threat or successfully resists it and returns to normal. So that means that your body can handle the stress and be fine with it. But what happens when your body can't handle the stress? What do you think happens? You think you function good?
You get sick.
Yeah, you don't feel good, you get sick, right? The third stage is the exhaustion phase. And I have a lot of patients that come in, unfortunately, a lot of patients come in initially in this stage, and then I have to get them out of this stage. This is the exhaustion stage where your body fails to return to normal. Okay? This can occur from prolonged upsetting experience, lowered body resistance, or your body's just basically malfunctioning. Okay? In the exhaustion stage, it says your body overreacts and continually reacts in that way to fight it. Okay? We have this heightened response causes certain hormones to be released primarily by the adrenal glands. Now, a lot of you know in here that know me, that have been patients for years, know that I talk about the adrenal glands a lot. I talk about something called DSF. I take something called DSF every day. It's a specific type of nutrition that's for your adrenal glands. Our adrenal glands in our body are specific glands that help us deal with stress on a daily basis. Now, if the adrenal glands are working properly, that means your body's going to be doing what? It's going to be doing fine through stress. But sometimes what happens is the adrenal glands, they stop working properly, and then the stress starts to take over our body. So I take a specific nutrition I've been taking every year. I use it as my multivitamin because it has almost everything a multivitamin has in it. But it also has a bovine source of adrenal gland that helps keep my adrenal glands healthy. So we'll talk about adrenal glands. So the adrenal hormones can cause the following changes in your body. So your adrenal hormones can cause a loss of your ability to digest food. It can cause a decrease in the circulation to the heart. A drop in the body's immune defense, or your immune system can be lowered from not having your adrenal glands working properly. And it says a drop in your oxygen levels, basically your oxygen carried by your cells. So we're under stress, our adrenal glands fatigue, and then all this stuff starts to happen. So what does that lead to? It leads to people getting what? People getting a problem. People getting sick, right? So they talk about this test, and some of you that know me that I've done this test before. There's a way to test, rather than just going to do a blood test to check your adrenals, to actually check your test very easily by taking your blood pressure. So basically, we're going to do this test on each one of you within the next week, because you're all here, you're learning about it, but some of you actually had it done before. If we lay you down for about 5 minutes and take your blood pressure while you're laying down, we take the reading. So the right number for most people in the textbook say 120/80, right? When you stand up, you're supposed to take the pressure again. When you take the pressure when you stand up, your pressure's supposed to go up by 15 points or more. So that 120/80 should now go up to 135/80. That shows that your adrenal glands kicked in when you got up. Does that make sense? So a lot of times you'll notice if we do the adrenal test that your blood pressure, well, let's go through the slides because it's going to show us this. Let's not go through that. But it'll show that when your blood pressure goes down, it shows that your adrenal glands are fatigued. So we don't have to just send you for extended blood work to see if your adrenal glands are functioning properly. They also do something called, the number 2 test is called a papillary response, where they shine light into your eye, and then your eye is supposed to constrict, right? So if they say what happens is if you keep the light in the eye and the eye is not constricting, that means that you have adrenal fatigue as well. So if you shine a light in your eye and you see your pupil start to respond and constrict, that's a normal response. Some people, you can shine a light in their eye and the eye will stay exactly the same. That also is an indication of adrenal fatigue. So I'm not a medical doctor, I don't carry the light pen in my pocket, but I do the blood pressure test in here all the time. And the blood pressure test, I actually think is a better test for you because some people wear glasses and their eyes may not be 100% perfect either as well. So what we'll do is throughout the time, within the next week, I want each one of you to remind me to say, let's check my adrenals by doing the blood pressure test. And all we're looking for, we don't care, obviously we want your blood pressure to be normal, but we want that spike to go up once you stand up. Once you stand up, that will show if your adrenal glands are kicking in, because now you're moving around. That means your body's going through some physical stuff, so your adrenal glands have to kick back in. The primary symptoms of stress are headaches, fatigue, pain, tension, in your neck, your shoulders, your back, irritability. Some people won't sleep. Some people get allergies from stress. Some people will get digestive problems. So there's 10 symptoms right away that stress can cause. And how many people think are coming in here with these things happening? So one of the things that we teach and along with chiropractic care is the reason we're here teaching and educating tonight is for things for you to do to stay healthy without chiropractic care. Everybody knows you're going to get chiropractic care, but what do you do when you're not getting yourself adjusted? Right? So, everybody has a stress survey. Let's take 30 seconds. You don't have to fill so much of the top part out. I know who most of you guys are. But let's look at the symptoms on there. Right? How many are you looking through those symptoms and can say, I have none of these? Right? I would be very surprised if half this room raised their hand and said they had no stress at all. If you do raise your hand, yes, Stu. I don't believe you, Stu.
It's been 2 years.
But I would be very surprised. I want to know what you're doing if you have no stress at all. Okay? But everybody's under some sort of stress. So how many people on that survey there checked off one or more symptoms on that survey? Right? More than half the room has one or more things going on in their body due to stress. So let's go over some solutions on how to reduce some of your stress. Okay? Right? Some people think, hey, some people think there's different things that you can do to release your stress. Now everybody in this office right here, sitting here tonight, is different. So some things may work for you and may not work for somebody else. Donna's saying a nice glass of wine at nighttime relieves her stress. But that's not what we're saying to go become an alcoholic, right? So that's not what we're saying here. But everybody's different. Some people may drink a glass of wine and get a headache. So that may not work for you. Some people like to go and do a run. And that can get them stress-free. Some people say, I don't run at all, right? Some people may say, I need vacation, like I say. I need vacation to relieve stress. So there's different ways for each person to relieve their stress. But the only person that can figure that out is your own self. So everybody has to look at their own life and realize, this is what I do to relieve my stress. And you have to incorporate that in your daily schedule. Or at least your weekly schedule. If you're going on and on, I was explaining to patients before, if you're going on and you're on the go, you go to work, you grab your kids, you go here, you go there, the next day, same exact thing, and you never take time to calm yourself down and relieve stress, what's going to eventually happen? Your body's going to do what? Go into the third stage, which is the exhaustion stage, where it's not helping you. Your body's not keeping you healthy. So you want to make sure that you start learning the things to do to prevent and reduce stress. So the first thing, it says, you can prevent stress by, number one, working on your adrenal glands from becoming exhausted. So everybody should be on DSF, okay? These are your glands that we've already talked about, that if they overreact, it's not good. It says, besides environmental factors, the adrenal glands are stimulated by caffeine, tobacco, and sugar. So we know that we need the adrenal glands to be healthy in order for you to be fighting stress all the time. But if you eat sugar every day, if you're drinking 5 cups of coffee a day, and if you're smoking, you're doing what? Yeah, you're exhausted. You're putting yourself more towards the exhaustion stage. You are damaging your adrenal glands so they're not going to work properly, and your body's not going to have the ability to fight stress off that fast, or even slow, or maybe it just will stop fighting stress off, and that's when people get sick, right? They say, you know, I do a lot of research and I read a lot at nighttime, and they say that people that went to the hospital today felt good yesterday. You understand that? Does that make sense to you? Some people that are going to hospital right now felt fine yesterday. But how many people are evaluating their lifestyle and saying, let me keep myself healthy before I hit that exhaustion stage? Right? That's what this is about tonight. This is about for each one of you to sit here and realize the things that you're doing that are great for yourself, the things that you're doing that are not so great for yourself, and then the things that you can clean up to make sure your health stays healthy, and that your body stays healthy, and that you continue to get older and stay healthy rather than going and being in a hospital because something happens because of all the stress or all the different things that we haven't taken care of ourselves. And how many people need to be here learning this? How many people? Everybody knows somebody that needs to be learning this right now, right? Everybody knows somebody that is not here, they're working, or they're home with their kids, or they're just running around like crazy, and they never take the time to stop and say, deep breaths, right? Relax. How many times do you hear me say every day, take some deep breaths, relax? Why do I tell you to do that? Just because I want you to breathe? Yeah, I mean, no, I do want you to breathe, but it calms your body down. So a lot of times, taking deep breaths in your nose, out your mouth, will calm your body down. How many people can sit here and say, I can lock myself in a room for 10 minutes and just breathe and that's it? Most of us can't even do that because our minds are racing all the time. Try tonight to lock yourself in a room, tell your husband to leave you alone, tell your kids to leave you alone, shut off the TV and just sit in a room, close your eyes, think about something that makes you happy, and take deep breaths in your nose and out your mouth for 5 to 10 minutes, and it's going to calm your whole body down. So breathing is a big help for stress. Okay? And because keep in mind our ancestors, right? They consume less sugar in a year than we consume in a day. So most of our parents or grandparents, they consumed what we consume a day in sugar right now, they consumed 50, 60, 70 years ago in 1 year. So that's the amount of stress that we are putting on ourselves by the foods that we're taught to eat right now. Everything is very unhealthy for what we're eating. Type 2 diabetes is an epidemic in this country right now, meaning more and more people are coming down with type 2 diabetes. And type 2, does anybody understand between type 1 and type 2? We know that? So type 1 is what?
It's usually genetic and it's
yeah. Type 1 is when it's in a child. Usually, like, you know, they're either born with it or they develop it very early and they call it type 1. But that's very low percentage of people. Type 2 is 60% of America. 60% of America is type 2. 60%, and those are actual statistics that are researched, not my research, medical research, is we're doing it to ourselves. Because we're eating all sugar, carbs, caffeine. We're destroying our bodies by what we put into it. And then on top of it, we have all this stress anyway. So we're nutritionally not doing the right thing. We're keeping bottled up stress inside. Every day we're working. And then talk about, you know, God forbid, parents, this, that, kids. They drive you crazy. I mean, there's so many different things that are getting thrown at us at a certain period in time that the body's response is there's no other way for it to go but exhaustion stage. So what we want to do is we want to educate you tonight on different things and methods on how to get yourself healthy. The second method to help your body is by taking certain types of vitamins. So we talked about the DSF for the adrenal glands. There's also vitamin B complex and vitamin C. And then they talk about the adrenal extracts. So personally, during the winter time, I talk a lot about vitamin C, about keeping your immune system strong. B complex is very good. It gives you energy as well. So there's specific types of supplements and nutrition that some of you may not even heard of. A lot of people don't even know what vitamin B complex is, or never heard of adrenal support, something like a DSF. And that's why we're here tonight, showing you that there's other things that you can do to kind of help yourself and help your body push in the right direction, which is all natural. Because the minute you go to the medical doctor and tell them that you're stressed, and then you got a headache, and then you have anxiety, what are they going to do? They're going to give you prescriptions. And ultimately, how long do they want you to be on the prescription for? Forever. And you really think that's going to get your body out of stress? Prescriptions, every single prescription that you see on the TV, right? The first commercial is what? Yeah, they're dancing in the air. First what? 20 seconds, right? And then all of a sudden, the last 45 seconds of the commercial is can cause heart disease, bleeding, puking, sudden death, right? It's insane. And then but we're all laughing here. But the problem is that the next day, Americans, being stupid, excuse me on camera, but will go to the medical doctor and get the same drug they just laughed at last night. Because number one, they don't research what they're doing either. A lot of people don't take the time out to actually educate themselves on how to be healthy or how to be healthier. I got people coming here and telling me they're on 10 drugs. It's good for them. Because the doctors make it like this is going to help you, and it's good for you, but it's not good for you. So we need to teach and educate, and the reason I take my time and do this is to educate you that that's not the right way to be healthy. And eventually that's going to catch up with you, and you're going to be sick, or you're going to be on dialysis, right? Filtering your own kidneys and liver, because why? Your body can't handle the medication and the toxins anymore. So the reason we're here tonight is to educate you on how to keep yourself healthy so that doesn't happen to you anymore. Or that you can learn how to do different things to get out of that stage of where you're at right now. Okay? It says stress destroys B and C vitamins. These vitamins are water soluble, so they're not stored in the body. That's why you need to take a consistent source of vitamins. So most vitamins are water soluble, means your body doesn't hold on to them, they get rid of it. So that's why consistently taking vitamins is very good for the body. It says vitamin A also restores the thymus gland, which increases your immune system, which can be depleted by stress. So how many people knew that about vitamin A? Right? So now you learned something about just vitamin A alone. It helps your thymus gland, which also helps your stress. Okay, it talks about potassium. Your adrenal glands cannot function without this important mineral. Hypoglycemia, which means somebody has low sugar, can be affected as a result with that. So magnesium is very good for that. I'm sorry, potassium. Magnesium is very good for the vital minerals in your body. Okay? So you want to understand that there's also natural things that you can do to help your body heal and push you out of stress, and also keeping yourself away from medicine. A lot of times most people don't realize that the medicine that you're taking has a lot of natural vitamins in it, but then there's chemicals on top of it. So the vitamins that we have are very high quality vitamins that have a high potency nutrition without the chemicals that are going to harm your body. So some people don't know how to take vitamins, and that's why we educate and teach you how to take specific things. That's why most of you are going to get a nutritional checkup around your 12th visit. Some of you have already been through that. Some of you have been on some of these vitamins. I have patients that are here for years of mine that have been here for years now and are on a great source of different vitamins. Like Stu's been on some great stuff and doing phenomenal with his health on specific vitamins.
So the function of the magnesium is to open those cell receptors?
Yes.
So that it receives in the vitamin.
Yes, exactly. So the third stress is what everybody hates, is third way to relieve your stress, which most people don't do all the time, including myself, is exercise, right? Everybody has an excuse why they can't exercise. I work too much, I got my kids, this is on, I'm doing this weekend, I need to sleep a little extra. So there's so many different reasons we give ourselves to not exercise, but exercise is a huge way to relieve your stress. Now, I'm not telling you to go join a boot camp, which I'm doing on Monday, because I need it, but there's different ways you can relieve your stress through exercise. Let's go through it. So it says, a recent study showed 40,000 postmenopausal women for 7 years. Those who regularly engage in moderate activities had a 41% lower death rate than those who did not exercise. So look at that. 41% is almost half the people. So big difference. 41% lower rate of not dying just by getting exercise into my body. That's a big statistic. It says go for a walk. California State University found that a 10-minute walk can increase your energy, alter your mood, affect a positive outlook for up to 2 hours. 10 minutes could cause you 2 hours less stress. 10-minute peaceful walk. Right? So how many of you are nudging your husband? See, I told you we should have went for a walk, right? Right? A lot of that happens, the same thing. So the only person that you could really rely on that you want to understand is really yourself. Health is an individual thing. Obviously, we want our families to be healthy with us because we don't want to be the only person alive when we're older. We want our family and our husbands and wives and our kids and our parents to be with us. But health really is the only person that really can help you with your health is ourselves. Other people can give you the push like myself. You can have a good support system at home, which I recommend, which is your husband or your kids or your parents to help support you in your health. But the only person that can actually make a change in their own health is themselves. Nobody can do it for you. So this is a workshop to say within myself, I need to start doing better. But we also want you to drag your husband or your wife along with you too. But if they're not going to come, then you need to make sure that you're not staying home with him, that you're going to keep yourself healthy. So it comes down to the own individual. All of us can change ourselves. We can influence others. That's what we try to do, right? That's why other people, half of you guys always send your friends and family in. You try to refer me patients because you're trying to help other people. But it's up to them to get here, right? It's up to you. The people that show up get well. The ones that don't show up don't get well. But it's up to us to show up. And I can tell you consistent people that show up all the time are staying well. And I have patients that are sitting here right now that show up consistently and see better changes within their health, just under normal chiropractic care. That's without eating properly. This is just chiropractic care, getting people healthy. Now on top of the chiropractic care, if we're teaching you how to eat right, or we're teaching you how to avoid the sugars, the caffeine, the stress, you're doing your 10-minute walk, you're doing your breathing exercises, now you're going to see your health do what? Go up. Instead of as you're getting older, come down. Most of us see some people walking outside, they're 70s and their 80s, and they're like, wow, they're doing great at 70 and 80s. But that's kind of like far-fetched, right? Because a lot of us see the other side of it, 70 or 80s, and they're walking around, and like, I don't want to be like that. But those are the type of people that never took care of themselves, and that's how they got that way. You understand? Like, people think that, like, they go to the doctor and they think, oh, I feel good, I'm healthy. But health doesn't mean to feel good. Health is the optimal function of my body. It means if your body's functioning. And how do we know if our body's functioning or not? What system controls function? Your nervous system. So how many people need to see a chiropractor? Because we work on the nervous system, right? Everybody out there needs to see a chiropractor because chiropractors work on your nervous system. So they work on your function. When your function's well, you're going to feel well. But let's not wait to feel bad and then our function's completely off. It takes a lot longer to get that back. So health is an active thing. And that's what most people need to realize. You have to be active within your health. People in this country, they wait to get sick and then they want to get healthy as fast as possible. But the problem is it's all the wrong way in this country because it's just taking drugs. And they think they're going to get healthy by the more medicine they take. So most of you need to understand and realize, and a lot of you guys are here tonight are actually really good patients, number one, and you listen, and you're here because you want to learn, and you want to be active in your health, and I commend you for that. But there's a lot of people that don't do that, and they wait to get sick. That's why I talk about the people who felt good yesterday are in the hospital today. Because they're just waiting to get sick. Instead of being active and taking care of their bodies and taking care of their health and not getting sick. How many people do you know that retire and then are sick? They work all their life to make money, to put away for a pension, to put away to go on a cruise. They telling themselves 20 years in, when I retire, I'm going on a cruise, or I'm moving here, and I'm going to enjoy myself. But by the time they retire, because they never took care of themselves for 25, 30 years, they're sick by the time they retire. It's insane how many people are sick by the time they're getting retirement. So what's the point, is the question. If you're not taking care of yourself, and you're working and stressed all day long, and then you think you're just going to retire, and now you're going to enjoy it, you got another thing coming in this country. Because most of those people are sick now. And they're spending all their money that they should be gambling and on cruises and having fun, getting their health back. And a lot of times it's too late at that age. So the real key message tonight is to actively take care of yourself and make sure that you're helping others take care of themselves. Because like I said, we don't want to be the only ones healthy. We want our family to be healthy with us. Okay? Over a 7-year study at the University of Minnesota involving 12,000 men found that those who walked or did similar exercise for an average of 20 minutes a day were 37% less likely to die of a coronary disease, which is a heart attack. So 20 minutes a day for men, almost 40% better with your heart. And what's the number one cause of death in this country right now? Heart attack. So 20 minutes. How many of us can make 20 minutes? Right? And if you think about 20 minutes, it's nothing. It's nothing. But it's crazy because like we act like 20 minutes is like 18 hours, right? It's insane. You make 20 minutes just to walk up and down your steps, and you're 40% less likely to get sick, to die of the number one cause of disease in this country. That's how easy it is. Like, it's just insane. Like, people don't know that. And if I teach it and educate it every month, and some of you may sit here and get it, and then 5 minutes after you leave, don't do it anyway. But the thing is that if I made it through to you, 3 or 4 of you, or 5 of you, or 10 of you, it can change your life. It could get you out of the statistics of what everybody's dying from. Okay? The fourth solution to reducing your stress is to have more fun, and believe it or not, it's laughter. Right? So they talk about laughing. What do they talk about with laughing? They said research show that comedy lowers your body's level to stress. Thereby, it lowers your blood pressure, it increases your white blood cells, which fights off disease. So laughing and enjoying yourself calms your body down. It reduces stress. So everybody needs to laugh more, everybody needs to have more fun, and everybody needs to stop taking everything so seriously all the time. Alright? Does anyone agree with that? How many people are there? They say, I think that another slide I said, it says, by the time children reach nursery school, he or she will laugh about 300 times a day. Adults laugh 17. Isn't that crazy? This is research. I didn't make this stuff up. So when we're younger, we're having a lot more fun, and there's no stress when we're young, right? But then we get adults, and this real world comes around, and we're only laughing 17 times a day, and that's probably an average.
That's a lot.
That's, yeah. Right? That's crazy. So these are all things that some of us didn't know. The fifth solution to reducing your stress would be what? Is what I do. Working on your nervous system. Because we talked about function. What system controls your function? Your nervous system. It says stress causes tension to build up in your muscles and joints. This tension causes alterations with your normal structure of alignment to your spine. Right? Your muscles get tight. Right? We grab a spine here. Right? Here's the bones to the spine. Here's your pelvis. Here's your spine. Here's your skull. Right? Now make believe your muscles are attached here. We get stressed, our muscles get tight. What does it start to do to the spine? Pulls it out of alignment. It does what to the nerve? Your spine comes out of alignment. It puts pressure on the nerve. There's a name for it. We call it something with an S. Subluxation. So how many people are suffering from subluxation every day? Right? A lot. That's why my office is so busy. Okay? I'm not busy because I like to be busy. But the thing is like There's so many people suffering with this type of stress, and it's affecting your nervous system, which controls your entire body. So every single person that's in this country should be seeing a chiropractor. No matter if they feel good, they don't feel good, because the nervous system controls everything. So why not take care of this system? Why is this always the last system everybody looks at? It's unbelievable. Everybody's looking to take something first. All you do is work on your nerves, your body gets healthier. And a lot of you are sitting here, some of you have only been here a week or two and starting to see my body's changing and getting better. Some of you have been here for years and notice I haven't got sick in years since I've been taking care of my nervous system. So we always recommend that you take care of your nervous system. Now, how many people are sitting at home that don't know this? Now, I can't reach everybody. That's why we ask you to help us reach other people. Take this message to other people. Check your nervous system, right? Make sure that you're telling your friends and telling your family. It doesn't mean that everybody needs to be worked on, because I do have people come in that their nervous system's doing great, and I tell them keep doing it, or come in once a month or once every month just to check and make sure it's staying healthy. But most times I see people when their nervous systems are all the way down here. And then I got to spend a ton of time and energy to building you back up. But if we just got it from the get-go, we wouldn't get sick. We would keep ourselves healthy. Okay? Your nervous system can be damaged by accidents, poor posture, birth, falls, injuries, repetitive motion injuries. So I like to go over, the only thing I want to go over here that most people understand is birth, okay? Birthing process, which upsets me in this country, it's done the wrong way. We lay the women lay on their back like this, right? And the doctor says, oh, baby, yay! And they pull the head, and they yank the head out. So what are they doing to the nervous system that's not even developed yet? What are they doing to it? They're putting pressure into the nervous system. So this is why in this country, there's so many kids dying at birth. There's so many kids right now that have ADD, ADHD, birth defects, birth problems. The kids aren't developing right because of the process. You're really supposed to have a baby like this, squatting, right? And it's supposed to be a natural process. Most people don't realize, a lot of us are sitting here a little bit older than not having children anymore, but they don't realize. And how many people know that if you have like a daughter or a nephew or a niece, but they're saying that, oh, I had to do a C-section. Everybody has to do C-sections now. Why? Because it gets them out faster. And how healthy do you think a C-section is for a child? Birth is supposed to be a natural process. You're supposed to wait till the baby comes out. Maybe there's some cases that you can't wait, obviously, but most cases, it's a natural process. When the body and the baby's ready to come, it's going to come. But in this country, there's hundreds of kids being born in an hour, and the doctors can't wait. So they say, you need a C-section. They rip them out. And now they're going in with forceps and grabbing kids, and wonder why these kids are sick right from birth. And we have more kids dying in this country at birth than any other country in the world. It's insane. And this is why we educate. Have you ever had a pebble in your shoe? It says, if you ever have a pebble in your shoe, what's the worst thing, right? You want to get that pebble out. It's the same thing when you have pressure on your nerves, right? It's very sensitive. Okay, so some people have questions about chiropractic care. We always answer those questions. And then it says, a recent study showed that 4 out of 10 American adults are starting to use alternative care, such as chiropractors. Chiropractors are actually the #1 in alternative care because they actually choose the natural approach. And it says a study done in the past showed that 8%, over the past year, there's an 8% increase in people going to chiropractors, which makes me really happy because that means if I have a child, then my child can maybe become a chiropractor. So it's showing, but not just that, my own selfish reasons, I want one of my children to become a chiropractor, but it's showing that what? Chiropractic works. If it didn't work, you think there would be an 8% across the United States, more and more people going if it didn't work? it's going up, and more people are going to chiropractors because of what? Number one, it works, and number two, the other method is failing. The medical method is failing people. It's killing people every day. And the public is starting to get a little bit smarter now to seek other options before they're going to do surgery, before they're going on 10 medications, before they want to go on drugs the rest of their life. They're starting to see other options. And chiropractic is not the number one other option right now. Because why? Why would it be number one? Because what system do we take care of? The number one system in the body. It controls everything, your brain and spinal cord. So it's like a no-brainer, but how many other people don't know? I'm hoping that every single person on tomorrow, we're going to be on the news, watches the news so they can see. I don't even care. As long as they hear something good about chiropractic, they can see maybe I should see a chiropractor. That's all I care. I don't care if people come in here or not. I just want the profession to do well. Because I want the people to see on the news that chiropractic can help people. And there's, I think, like maybe 10% of America go to chiropractors right now. The other 90% are doing drugs. So I want the other 90% to see the news tomorrow night and see me there and saying chiropractic can help you. Because it can. Because it controls your function. It helps your function. Your nervous, stress-related problems have response favorably to chiropractic care, and all the research studies show that. An example shows that 75 male and female subjects, chiropractic treatment has caused a remarked drop in high blood pressure after only 1 minute. So every time I adjust you, your blood pressure should be dropping. Sometimes in here, if I have time, because we're adjusting a lot of people, I'll take your blood pressure right before I adjust you, and I'll take it right after, and you'll see it drop right after. And you'll be amazed after the adjustment how your blood pressure drops. So the number one drug most people are on in this country is what? Blood pressure medicine. So if chiropractic can do an adjustment, which is all natural, help your blood pressure without taking medicine, how many people would want to keep doing that? How many people don't even know that? This is why we're here educating, guys. This is what we do. Notice that chiropractic adjustments decrease the number of headaches, the number of headache hours by 69% after 2 weeks of care. So I got people coming in here with extreme headaches. I adjust them a couple weeks later. 70% of the headache is gone. 70% of the amount of headaches they're getting are gone. Some of you know that offhand. Some of you come in here with headaches. And you notice when I adjust you, the headaches are gone. Clinical study was done on a group of patients suffering with ulcers comparing to traditional medical care and chiropractic care. The group that was receiving chiropractic care experienced pain relief an average of 10 days earlier than the medicine. So some of you are coming in with stomach problems. I adjust your middle part of your spine, right here, that controls your stomach. These nerves go around to your stomach and tell your stomach to digest. But a lot of people doing what? Taking drugs for their stomach. And I can do adjustment, a couple weeks, stomach clears up. I have people come in this office, and sometimes they don't know that I can help them with certain things. And weeks later, they say, Doc, I never told you that I had a stomach problem, and my stomach problem's gone. And I didn't do nothing besides getting adjusted. Some people will tell me, Doc, I never told you that my prostate wasn't working properly, and I went back and took a blood test, and all of a sudden, I didn't change anything, and now my prostate's healthy again. Do you know how many women come in here and tell me my thyroid doesn't work, and I adjust their neck, and all of a sudden their thyroid's doing better? Your nervous system controls everything. With the proper scientific chiropractic adjustment, is what we're doing in this office, can help your whole body. Sometimes it can take time. Everybody knows it takes time to heal because it took years and years of stress to get you the way you are. So it does take time to heal. But it's better than taking medicine that's going to just destroy you and kill you. It says to reduce the number of harmful effects, one should eat a healthy diet, exercise regularly, and make sure their spine and nervous system is functioning normally. Now we're at the end of the workshop where I get to give a gift. So tonight I talked about specific nutrition. And you know that we do carry nutrition in the office. So tonight, everybody gets a gift of 10% off any type of nutrition, whether it be your adrenal support, whether it be your B complex, your vitamin C, vitamin D, whatever you decide. Some of you are on a bunch of nutrition already. Whatever you decide you need, you get 10% off already as a gift tonight just from me. The next gift I'm going to give out tonight is a better gift than saving a couple dollars. Is the gift of health. It's bringing in a family member this week and giving them a free examination for their nervous system. And some of you that your husbands are sitting home saying, no, you know they're sitting in pain, but no, they won't come in, getting them in for a free evaluation. Some of the people that know that people that don't have the money to come in here still can get a free evaluation. That's the gift tonight, besides getting some money off your nutrition if you want to buy it. The gift is for everybody to leave here tonight, and everybody knows somebody that needs this type of care, that needs me. Or needs a chiropractor. Doesn't have to be me. Just make sure that the chiropractor is a good chiropractor. So the gift tonight is to bring somebody in this week to get a free evaluation. So they can evaluate their nervous system to see if their nervous system is inhibiting them from being healthy. Or if we can help their nervous system get them healthier. Does that make sense? How many people think somebody else should have heard this tonight? Shouldn't we have like a big crowd here? Yeah. Right? Don't you think a lot more people should know this? Yeah. So I do these workshops every month. Every month I pick a different topic. I research the whole month long, and I put a workshop together so I can educate the patients on different topics. Next month I want to see double the amount of people here. Hope it doesn't rain, because my last 3 workshops it's rained on a dead night on here. But I hope it doesn't rain. But the thing is that everybody knows somebody. Bring a friend. That doesn't mean that we're bringing them to be a patient. We're bringing them just to learn, to get educated. We're bringing them into this office to get a different approach to taking care of my body and my health. So bring the people to the workshops. It's the best way to bring people. If you know them and they say, oh, I don't know if I want to go get an exam, we're not doing an exam tonight. You're going to come and learn. You need to come and drag them here, and you need to learn. Because if we're not doing it, if you're not helping me do it, they're staying sick. So the gift tonight is the gift of health, to bring in friends and family for a free evaluation. You also get 10% off if you need to buy anything in the nutrition cabinet. I appreciate your time, guys. I thank you guys for coming all the time. We do this every single month. Our mission is to help as many people as we can through chiropractic care and natural healing. And I look forward to seeing every one of you guys stay healthy, getting well, and for you and your family. Thank you, guys. Appreciate it.